I'm here to demonstrate suturing of a wound, and at first, before we proceed, we have to inform our patient about what is our assessment of the wound. For example, this is a lacerated wound, and then you have to give the patient discuss with the patient all the indications, contraindications, risks, and benefits of the procedure, and also you have to get an informed consent to the patient. At first, you have to consider a person must be of sufficient mental capacity and of age. Patient's rights must be presented with sufficient information for recommended procedure that allows the patient to make an informed decision. You have to discuss the patient about the procedure that you're going to do, and then this is this procedure is to reduce the risk of infection, and then what are you going to do? Will administer anesthesia to numb the area so that you will not feel anything about the procedure, or less that you're going to feel. And at the same time, and once the area is numbed, you will start making your using your sterile needle to suture the edges of the wound. And then this will help properly heal the wound and minimize scarring. The indication is for this wound is normally being done for lacerated wound, deep or gaping wound, or jagged wound. And then the risk is, of course, in any there's a risk in suturing the wound. It can include infection, bleeding, allergic reactions to anesthesia, and scarring. In rare cases, wound might be reopened, or it will heal for a prolonged period of time. The benefits of this one is for proper wound healing and reduce the risk of infection and minimize scarring. Here I will demonstrate to you at first is how to clean the wound. Assuming that the area is a sterile area, I will now use my gloves. Assuming these are sterile gloves, I will start wearing my gloves. And this area will be, assume the other half of your table will be the dirty area. And after this one is you have to clean the wound. At least first, what you will do is clean the wound, flush the wound first with sterile water just to clean the wound. Assuming that this is normally we use a 60 cc syringe, and proper use of PPE to prevent from having the irrigation goes to you. So assuming that this is the wound, you will flush the wound for 60 cc. Make sure the wound is clean. After the wound is clean, you will start cleaning the wound with usually it's cleaned by either povidone iodine or chlorhexidine. This is, as I've said, assume this area is a sterile area already. Open this one, and then apply your betadine. When you're applying it, it has to be inside out around the wound 3 times. After the wound is clean, and now you are going to introduce the local anesthesia. Usually we use lidocaine either 1% or 2%. Assuming that this is the lidocaine, usually when you get a lidocaine from this vial is you use an 18 gauge needle, extracting the lidocaine. And then after extracting the lidocaine, you will use normally a gauge 25 needle to inject the anesthesia to the patient's wound or to the skin. This is the gauge 25 needle. First, you will clean the area, wipe it off with your betadine. This is all sterile filled. Injecting the anesthesia using a diamond shape. First, you will on the edge of the wound, you will introduce the anesthesia at the edge of the wound, assuming that you're at the half of this one. So when you insert the needle, as you withdraw the needle, you introduce the anesthesia. At least on each side is 1 ml on each side, assuming you're injecting the wound as you withdraw. After that one, you can also go to the other side. At the same area where you inserted the first one, you can just go over on this side and on a diamond shape still, introduce the needle. As you withdraw the needle, you inject the anesthesia. Then after that, you go to the other side, so approximately until this one, and then you can insert again the needle towards the other end. And then as you withdraw the needle, you introduce the anesthesia. You inject the anesthesia as you withdraw. And then again on the other side. Assuming all the anesthesia has been provided, then you wait for a few minutes until the area is numb. Sometimes what you normally do is just to try to check it if the patient still feels it using your forceps. If the patient doesn't feel it anymore, you can do the next thing that you will do is to cover the area where you're going with the wound with a sterile drape before you do the procedure. Let me bring out all the equipment I'm going to use for this procedure. And using your nylon suture, your Prolene suture, usually your MA or your give it to you, or sometimes you prep it already using a sterile technique when dropping off all these supplies, including the suture. Grab the end of the needle and then get your needle driver, biting it to the 1/3 of the suture, the other third, and then using your forceps. And then when you're starting to suture, start first at the middle of the wound, and approximately bite is around 1 centimeter or less when you introduce the needle. It has to be the same on the other side also. You can drop your forceps and try to pull your suture. This is a sterile area so that you can drop your needle within the field. And then you leave the end of this one around 1 to 2 centimeter, enough for you to do your tie, and then 2 throws first, grab the tip as much as possible of the other end of the suture, not to strangulate it, just to make sure that they are near each other on the edge of the wound. Please make around 6 loops back and forth. Four. When you cut this, cut at least 1 centimeter. Sometimes when you have an assistant, your assistant can cut it for you. But if you're doing it by yourself, you have to make sure that you cut it and do not run. As I've said, you always start at the middle. Now on the second suture, it doesn't matter wherever you start. It's either on the top or the bottom of the wound, as long as you can approximate it. So now let's start on the at the top of the wound. My needle driver is not holding properly the suture. Six. Now I can grab the other side of this side. Sometimes you can do directly, you know, with sweep to your hand here. You can put them all together. Let me remove this one first. It anchors the other suture, so make it clear. It's not going to anchor on the other tie. Four, five, six. Now, going to do more. This one, going to start on this. My needle driver is not grabbing the needle properly. Let me suture the last end. The patient's arm. The wounds already been closed. Assume it's all there. It's all on their other edge. And then after this one, you can cover the wound again. Cover the wound, and then with sterile dressing. And then after that one is you have to educate the patient, tell the patient when they need to come back, and then instruct the patient about how to take care of the wound. At first is, keep it clean and dry at all times. After the next day, they can wash it with soap and water and have it dry, and then put a sterile dressing on it. And then at the same time also give patient, if needed, some antibiotics or Tdap if needed. If the patient has no Tdap, normally we give it a Tdap, especially if the patient doesn't remember when was the last time they have the Tdap injection. And then discuss the patient follow-up. Sutures usually being removed around within 5 days, 5 to 7 days. They have a follow-up to the clinic and to evaluate and to remove the sutures, and inform the patient to call the clinic for any problems or concern, or if the symptoms for any signs of infection, call the clinic. And if it's really urgent, they can call. They can go to the ER if needed. Thank you, and that ends my demonstration on suturing of wound. Thank you.